Hi, this is Judy McCook. I'm a professor at ETSU in the College of Nursing, and I want to thank you very much for agreeing to serve as a preceptor for one of our senior nursing students. I thought I'd do this brief overview by Zoom, and you are welcome to call me. We can set up individual Zooms or phone calls or whatever else I can do to help support you. And again, thank you for agreeing to work with our students. I want to share the screen and show you some of the paperwork that the students will be having. You should be able to see my screen now, and that is our syllabus. I know all of you have been through school, you know how the drill goes, but this is the syllabus that the students will be working with. And I have a link for that in the email I'm going to be sending you. In addition, there's some other forms you may or may not have seen before. This is the safety orientation checklist for valid. Most of the students will be in a hospital facility, but not all of them. Some will be in clinics, but this is just the checklist that Ballard has asked that all students complete when they go into their clinical setting. This is a list of things that the student can and cannot do while they're on the unit. Things that they can do independently and observe are listed on the left. In the center are skills that require you to be with them if they perform it. And on the right is they cannot participate in. So there is a list there. And again, this is something that we have worked out with Ballard. So they are very familiar with this. Just because COVID is not completely gone away, there's a policy about screening, and that students will be screening themselves, taking their ear temperature, and making sure that they don't in any way impact the safety of patients. Couple other forms. This is one that we ask you to complete for us. It's just a little bit about you. You know, what your credentials are, where you went to school, a little bit about your work experience, and how much time you've actually been on that particular unit where the students are assigned. And then the two pieces that the students will be focusing on is, one is their log sheet. So every time they work, it's a 12.5-hour shift, but they only get credit for 12 hours. As you all know, we don't include lunch, but they should be doing 10 12-hour shifts for a total of 120 hours. If you have a student that's in the clinic, they'll actually be doing 15 8.5-hour shifts for a total of 120 hours. So they've got a log sheet, and then the other piece that we ask that they fill out is what we call a clinical judgment assignment. And they've got 5 different areas that they are to complete. And this is on one patient per shift, per clinical shift that they do. So they're going to do a clinical assessment, include the history of the present illness, past history of significant. They're also going to be including their lab data, and I want them to include the normals, and then if it's elevated, to put a star, and if it is in critical levels, to put 2 stars, so that I know they've recognized some lab work that's been certainly out of whack and a risk factor. The second part is that we ask them to identify the top nursing problem, the top priority, and document that with risk factors. And then we ask them to retrieve a hospital policy related to the care. So if they're getting blood, or if they're having a catheter inserted, they can pull the policy and include a copy of that. And we will give them instructions as far as how to do that, but that may be something that they ask you about to see which might be an appropriate policy for that client for that assignment. We also have them reflect on their own personal skills, how they managed their time during that shift. We also encourage them to look at opportunities to interact with other health professionals. So there's an interprofessional piece of this as well. And then as far as client education, we always ask that they participate in that. If the patient is unresponsive, then what kind of teaching did they do with a family member? So that's kind of their clinical assignment and what we grade them on. And then the clinical log I mentioned, all we ask is that you sign it at the end of the 12-hour shift, so that at the end of the time we've got all the dates documented for the shifts that they've completed, and we know that they have a total of at least 120 hours. Okay, and those are the two pieces of information that they have to complete for us. So I will ask that we schedule some time near the end of the semester when they're almost through, like if they're, around clinicals 8, 9, that we spend just a few minutes, the three of us on a Zoom, you, myself, and the student, and it shouldn't take more than about 10 or 15 minutes, but just to kind of touch base and see if there's anything else they need to work on before they finish their preceptorship with you. And again, I thank you so much for agreeing to do this, and look forward to Zooming with you. And again, I am available. The best way to reach me is my email, and that will be on the email that I send to you as soon as I finish this. And I'm happy to phone, Zoom, however you want. If you'd like me to come meet you in person, I'm happy to do that. Again, thank you so much for you helping us out and helping get these senior students on their way and graduated, and hopefully working with you and helping. Okay, take care. Thank you. Bye.